So, welcome everybody. I'm going to just introduce our speaker today. Luke Watts is the founder of the Cancer Coach, which is dedicated to transforming healthcare of cancer and chronic illnesses through lifestyle intervention. Luke has pioneered the anti-cancer Super 6, an innovative approach focusing on the core elements of health, diet, cancer, stress, sleep, gut health, and toxin protection. The Cancer Coach operates across 11 countries, operating a network of qualified health coaches who specialize in supporting individuals with cancer. There's a lot I can say about Luke. He has a lot of experience and a very wide reach. I'm very interested to hear about what Luke has to tell us today, and I'm going to just pass you over to Luke so that he can give more of an introduction, let us know what he does, and hopefully give you some insight that can help you. So over to you, Luke.
Wow, wonderful. Well, thank you very much for inviting me to join this webinar and meeting you, all the members that have come to join it for this afternoon. The Cancer Coach was born really from a necessity that we found between the glaring gap that came between somebody who had had a cancer diagnosis and the medical establishment. And what we absolutely adore about our medical establishment is their ability to treat what is required and what is in front of them at such a wonderful degree of expertise and understanding. However, we found that there were many areas typically under the control of the patient themselves that, if they were guided delicately and with empathy, could actually look to reduce the burden of the cancer treatment journey. So what we mean by that ultimately is looking at our own lifestyles, looking at the environment that we live in, and taking some ownership and control over what we can do to actually aid in the recovery, the treatment, the recovery, and the survivorship of cancer. So the Cancer Coach, as it was just mentioned, is now in 11 different countries, speaking 5 different languages. And our network of coaches predominantly are cancer survivors themselves. Many have gone through the experience and wanted to give back to those who are suffering. They are qualified through various boards. So in the UK, it's known as the UK International Health Coaches Association. And there are equivalent boards in the United States and in Australia. They come from, as I said, a position of lived experience, whether they themselves have had the disease or they have looked after somebody, a loved one with it. So the reason for this presentation is to walk you through as the understanding of what we believe to be lifestyle and environmental considerations for anyone that's going through cancer. And then also to explain a little bit about how health coaching works. We have got some offers and incentives, which I think we'll cover at the end of the conversation, inviting you guys to join some of these programs. But for now, I'm just going to walk you through a brief little presentation. So this is the Anti-Cancer Super 6 that was just mentioned a moment ago. And this has come from oncologists, nutritional therapists, physical therapists, dietitians, psychotherapists, people who have had a narrow point of view on how their specialist area could have an impact on somebody with cancer. What we have done is taken a more holistic approach and have attempted to bring in these 6 core areas of lifestyle and environment in one location, in one place. And the reason we've done that is that we were consistently being shown evidence that any one of these 6 in isolation could offer some benefit, but is not likely to be the silver bullet. And so many people on this call might know a little bit about certain food groups and the nutritional impact of dealing with side effects or complications from cancer, which is great. But in isolation, if that person is still struggling with not getting good enough sleep, or is dealing with the emotional trauma that's coming from dealing with cancer, depression, anxiety, stress, anger, fatigue, somebody who has not or has reduced the amount of mobility and exercise, it will not have the same lasting impact as if unless you're bringing all of these components together. So the anti-cancer super six, as you can see on the slide: nutrition, protection from toxins, exercise and movement, gut health, digestion and elimination, stress management, and sleep. And each one of those modules is afforded equal amount of time and space. But when it comes to working with cancer coaches, you might find that they would emphasize one area over another so it fits with your particular requirements and your needs at any given one time. But all the coaches are trained and appreciative of the holistic approach to treating cancer or managing a cancer diagnosis through lifestyle and environment. So there's two parts that I'm going to introduce you today. The cancer coaching program is kind of our core. This is what made us who we were over 10 years ago. And I have a little video here that I'm going to play for you, but we did a little tech test before, and I'm going to have to ask all of you to turn the volume up because I've been told it comes through quite subtly. The volume's not great, but I'm going to switch off my headphones. Let me do that.
Exactly is a cancer coach. Cancer coach is a qualified health coach dedicated to supporting you throughout your cancer healing journey. Coaching. First, to provide you with qualified and up-to-date information to put you in the best possible position, both physically and mentally, to support healing, enhance quality of life, and minimize the risk of recurrence. Secondly, it's about putting all this information into practice and making it happen in your reality. And that's where personalized coaching comes into place. Together, we will work on a plan that's personalized to your profile, your needs, and your priorities. It's all about implementing a new and sustainable anti-cancer lifestyle. Another important role of a cancer coach is to simply listen and provide a safe space where you can talk about your experience and let go of negative emotions. Many of our cancer coaches are survivors themselves who now dedicate their lives to support others just like you.
Guys still here?
Can't hear you very well.
Don't know why. Seems to want me to draw.
We've got a message that whether we can get captions on your thing. It was very, very soft actually, and now you're quite soft as well.
Why is asking me to do that?
I can hear you now.
Yeah, but for some reason it wants me to draw. That's okay. I think we're in.
There we are.
There we go. Apologies for that. Oh, it's going again. Okay. I don't know. Are you seeing this kind of
Yeah,
huge
well,
crayon?
I think we'll just have to ignore it.
Yeah, I don't know how I've done that. There you go.
Yeah.
So yeah, so as the little introduction was sharing, cancer coaching is in two parts. It comes as the form of uh, giving you a broad understanding of those different modules of health that we just talked about, and just as importantly, or just more importantly, is about making those modules work for you in your unique environment, meeting you where you are at, being able to what we call provide imminent relief to anything that's actually distressing you at any given moment. So, for those of you on this call now who have gone through cancer treatment, many of you would have experienced a lot of the more common side effects from the medications, whether that be a dry mouth or issues regarding bowel movements, issues regarding sleeping. All these are common areas, and we know that through targeted lifestyle and changes in that, we can actually relieve a lot of these common side effects and symptoms. So just a brief walkthrough here. The first thing that we do, we identify a coach that we feel that would best fit your profile. Typically, this is somebody who has gone through a similar cancer journey to yourself. Because we speak 5 different languages, we also try and align somebody as a native speaker to that coach if possible. The coaching is done via our online platform. It's all done through video, so you can take the coaching and have the coaching wherever you would like. Coaching sessions are recorded, which are incredibly handy. It allows you to use your time with your coach in the most productive way that you want without you having to take notes or for you to be sidetracked or distracted. You can always go back to the recording at your leisure and listen to it again. And you can share the recording. You can share it to loved ones or anybody else that's in your care group that's helping you get through going through the disease. Once coaching is completed, once the coaching session is over, which is typically an hour, the coach will then put together a personalized program. So we have thousands of hours of content on our database that's taken us over 10 years to create. But rather than giving you access to a huge library and you guys figure it out for yourself, the coach will actually curate a personalized well-being program meant for the follow-up of the coaching session. So if the coach is suggesting bringing in certain food groups, for example, to alleviate some bowel issues that you're having, or constipation or diarrhea, just as an example. Rather than just giving you the food groups, we can also give you a few recipes. We can give you a few things to actually to make. So really is a very interactive yet still very comprehensive program. And then point 4 there is the Pocket Companion. It's an app, you can download it, and ultimately you can take the whole program with you. So again, keeping the same example, coach is suggesting that perhaps you look at certain food groups, and here's a couple of recipes. You can use the Pocket app to go to your supermarket, and it'll bring you your little grocery list. That kind of help. So it's a very cool thing. So I guess I just wanted to lean on a couple of areas that we have got more involved with as we've been doing coaching over the years. So what we learned is as a coaching organization for people who are going through cancer, then there is something that we can call a prehabilitation program. So what we've typically found is those who have had the diagnosis would benefit from a more intense understanding of how sleep, emotional well-being, and nutrition can play a very significant impact into your ability to deal with those first treatment episodes. So, managing to cultivate higher quality sleep, being able to bring a sense of, give you the tools to have a more emotionally balanced point of view, which is not easy. And I completely appreciate that. Dealing with any emotion from, well, anger seems to be one of the most predominant ones in a prehabilitation program setting. So it's a prehabilitation program, works on the same function of having cancer coaching sessions, but it's more focused on those who are getting ready to start treatment. And then on the other side, we have a structured 12-week survivorship program. So what makes this slightly different to the program I've described to you today is that a cancer coach, typically at the point in which somebody's been diagnosed or is going through treatment, is actively looking for tactics to provide you with imminent relief. So to make you feel better about the cancer journey, give you the tools that you need to deal with the common side effects and complications that you are most likely going to have to experience. Once the treatment has been completed, there's a little bit more time in order for us to actually start addressing and building a longer sustainable lifestyle that's going to help survivorship and ultimately help reduce the risk of cancer recurring. So, and interestingly, why it's a 12-week program and a structured program is one of the things that we learned is that when treatment has finished, a lot of patients have become a little disorientated from what has been an incredibly structured process through their treatments. Every week having to go here for a test, every 2 weeks having to go here for treatment, every 3 weeks going here for a consultation. And once treatment finishes, a lot of that just disappears. And the long-term hope is that not only were we able to provide the patient with imminent relief during treatment, but they started to build on a foundation of solid understanding of how to actually live a long-term, sustainable new lifestyle that has been shown through countless studies to aid long-term recovery, reduce long-term complications and side effects from treatment, and ultimately work towards reducing the risk of recurrence. So this is a 12-week survivorship program that includes 4 cancer coaching sessions. And you can see the first 2 weeks, we talk about nutrition, emotional well-being, exercise, and basically it's the 6 modules that we talked about, but a more theory, pragmatic, dogmatic way, where we're not necessarily looking at imminent relief. We're now talking about how do we bring exercise and movement into your life? Now treatment is finished, now that maybe you're looking to go back to work or re-engage with your family and your community, how are we going to bring exercise and movement back into how we, for a lot of people, exercise and movement may not have even been part of their regular health regime. So how do we bring it in as an introductory? So it's a slightly different program, but ultimately still revolves around the core, which is bringing qualified, evidence-based lifestyle and lifestyle education and habit change into the lives. This one I just kind of tapped in on the end. I'm not sure how many people on this call are actually a caregiver, but studies continually show that caregivers are at a very high risk of getting sick themselves whilst they're looking after somebody else. So the latest study that came out that I read around February this year suggested people are 60% more likely to get sick as a caregiver whilst they're looking after somebody with a serious medical illness, including cancer. So we also have what we call this caregivers program, where we are looking to support that individual who then might be supporting somebody going through the disease. And it works beautifully in 2 ways. It provides a care program for the caregiver, a self-care program for the caregiver, but also the caregiver is able to, I guess, cascade some of the information that they are learning by working with the coach directly to that person who they are supporting and looking after. So, imagine a scenario where perhaps it's a mother or father in their 70s or in their 80s, perhaps might not be too inclined to want to change everything about their lifestyle. I know with my father, who's had cancer 3 times, we still joke that would he like some food with his condiments? He's set in his ways. But what he doesn't realize, and I know this is being recorded, is that when he's not looking, we do change his menu and we do make things happen. And we are bringing some of these concepts to him. So that's kind of how this sort of caregivers, it's good for the care, it's good for the individual, but also they get to cascade it sometimes to people who might not necessarily want to sign up to it 100% themselves. So the little program. Just a couple of, I actually thought I removed this slide. Obviously I didn't. We work a lot with insurance companies and what they call employee assistance programs. So they work with us because we're able to improve, as you can see here, quality of life, but also the likeliness that people are going to return to work. So I'm not sure if that is of any interest to anybody on this on this program, but yes, a 74% increase in the likeliness of people returning to work who do our cancer coaching program. 98% of people complete the program. And then we have a quality of life indicator, which is the QLQC30, which is the quality of life questionnaire, which is specifically aimed for people going through cancer treatment, where we are talking about how cancer coaching, or what we are doing, is helping them towards things such as emotional well-being. I think it's emotional well-being, pain, insomnia, and I forget the fourth one. Is it on the slide? Emotional stability, appetite. Yes, so they're the main quality of life challenges that people who are going through cancer. So I have another video, but maybe you guys can share this presentation later and watch it yourselves, because I think we had a technical problem there. But that's cancer coaching that we've gone through. So cancer coaching, one cancer coach to one person going through cancer, very personalized, highly adaptable and agile to meet the needs of the individual that's going through cancer. Around 2 years ago, well, longer now, wasn't it, the pandemic? In the throes of the pandemic, we realized that we weren't able to reach enough people, and people were getting more and more scared about what was happening with their treatments. And some of you on this call might remember that consultations were being delayed, treatments were being delayed and postponed, surgeries were being postponed. People just couldn't, and you've got people going through cancer. So in response to that, as well as a few other issues, we decided to flip the narrative. So if cancer coaching is the apex of what we do, which is providing one-to-one personalized support, and then it's the cancer coach's responsibility to access our content and make that content available to the patient, the Tree of Life program, which is this one you're looking on now, which is a vitality and cancer defense program, brings the modules up front, brings the content up front, similar to the 12-week survivorship program, but it has 7 modules as opposed to 6. And it's a step-by-step online guide to learning how lifestyle and environment can have an impact, not only in cancer treatment, but also, as you can see, cancer defense. We wanted to bring to people's attention that the more and more studies are showing us that genetics plays a smaller and smaller risk factor in somebody's likelihood of developing cancer, around 5 to 10% now, which means you're talking 90 to 95% of a cancer diagnosis risk is coming from lifestyle and environment. The World Health Organization consistently points out that up to 50% of all cancers can actually be prevented through lifestyle. That's out there. So we wanted to take an opportunity of using our content, which is good, solid advice for anybody who is looking to improve their lifestyle, but within the frame of what we know best, which is how cancer can be impacted by a poor lifestyle. So this is a vitality and cancer defense program. It is, even if you're not sick, there is things you can learn in this program to optimize your health. If you are dealing with quality of life challenges, if you're trying to walk up a flight of stairs, you get out of breath when you get to the top, or you're waking up 3 or 4 times, or 2 or 3 times at night, or you find it difficult to go to sleep, or you have regular bouts of inconsistent bowel movements, constipation, or diarrhea on a regular basis, migraines, headaches, all of these things that you might feel are not necessarily a diagnosed serious chronic illness, but are quality of life challenges. And to be honest, are probably the first indicators that life ain't great. The first little red flag of your body saying, particularly if you're getting these things quite consistently, insomnia, headaches, migraines, bowel issues, if this is something that's happening quite often, it's the first indicator from your body to say, hey, something ain't right here. So this is a program that's adaptable to those who don't have cancer, but might be dealing with what we call aggravating co-occurring conditions. So for the people on this call now who have a cancer diagnosis, who have had cancer, it is highly likely that you were presented with other chronic illnesses at the time in which you got the cancer diagnosis. And the most common of those right now is type 2 diabetes. The links between type 2 diabetes and cancer is now suggesting that you are 6 times more likely to get a cancer diagnosis in your lifetime if you're a type 2 diabetic. And if you want to speak to some of the more enlightened physicians in this world, they would tell you that type 2 diabetes is something that can actually be managed non-pharmacally. It can actually be managed through better control of lifestyle and environment. So in a rich, advanced country like the UK, in my opinion, there should be very little relationship between type 2 diabetes and cancer. So Tree of Life, it's an all-encompassing module. It's a prevention, it's a treatment support, and it's a recovery and survivorship program. And as you can tell, I'm very excited about it because it's doing really, really good work so far. And as I said, there's a little video on there that I think you can have access to. One of the most common questions we get asked is, where'd you get your information from? And as I said, there we have thousands of hours of content that all find their base, their root in some of the most prestigious, well critically acclaimed resources on Earth. These are peer-reviewed studies. I read studies before I go to bed. It's a very sad fact of life, but I do. I'm fascinated by anybody that wants to talk about chronic illness and lifestyle. And the more that we talk about it, the more we're going to be able to filter this into mainstream medicine, and they're going to be able to point people towards other support services outside of the traditional medical framework, whether that's working with a dietitian or physical therapist or a psychotherapist. It's a holistic way of life that we should be living, not necessarily something driven by pharmacology where we're constantly treating the symptom. So these are just some of the resources and access to some of the things that we do. I kind of talked about that already. So this is the app that sits in. You can take it with you and you can access the program wherever you are. Our leadership team, Dr. Penny Kegogalu, I never say her surname right, and you've recorded this, but I think I'm nearly there. So our medical director, she's also Deputy Chief Medical Officer for the NHS Coventry and Warwickshire, I think it is. Dr. Catherine Steele, actually that's Professor Catherine Steele now. So she's actually a tenured professor at the University of Leicester, and she runs our behavior sciences and she's our academic advisor. So everything that we're talking about here, this is not a medical program. This is, in essence, if you have to put it in a box, it's a behavior change modification program. It's about understanding the relationship that we have with our environment and our way of life and our illnesses and our health, and being able to make conscious decisions about our life choices to the point where they become unconscious decisions and become essentially habits. So Dr. or Professor Steele is all over that. In the UK, we work with the UK International Health Coaches Association, and Isabella Natrins is the CEO of that organization in the UK, making sure that our coaches are at the very, very top of their game. Their continued professional development is something they have to do every year to maintain their license. By being part of Isabella's group, it means they also are able to obtain professional indemnity insurance, which again shows how professional this program and the structure of our learning is. I get just some more credentials here, associations and authorities that we are aligned with. Some of those you might be very familiar with. ASCO, Society of Clinical Oncology. They're doing some great work right now. Australasian Society of Lifestyle Medicine, those two are good. I actually spoke at their event in Brisbane last year. That was very cool. So, and then just, yeah, a little bit more about who we are, what we're doing, the partners, hospitals, insurance companies, academic partners, Queen Mary's University in London, Baylor University in Texas. We also have University of Sydney now, which we haven't updated this for a little while. So we are consistently doing more and more studies using participants to come through our programs. We are charting the relationship between lifestyle environment and the efficacy of treatments, and particularly, you know, I have a 10-year study that I'm very that we're committed to, because it will take 10 years in order for us to know whether we have actually made a big difference when it comes to preventing the recurrences of cancer. It's a human trait, perhaps, not to necessarily deal with something until it's front and center. So as I mentioned earlier, cancer can present itself in aggravating pre-existing chronic illnesses, which can be affected and modified and treated at source before they become cancer. And I already mentioned, you know, the link between diabetes and cancer, heart disease and cancer is another one. Obesity and cancer is another one. So yeah, it's working with these academic partners means that our studies have credentials, and we're able to then put them more and more forward to what you might consider to be more allopathic medicine. I don't like using the word traditional medicine, but the medicine that you're familiar with when you go to the NHS. So keep being able to provide these studies. And we have seen movement. With the greatest respect, we have seen movement. And maybe some of you on this call have had an appointment with a GP in the last year or two, provided you can get an appointment. And perhaps you were fortunate enough to meet a GP who actually suggested, if you were presenting lifestyle, you know, a lifestyle issue, obesity or something like that, and they might have referred you to a nutritionist in the local area. So I do know the NHS are pushing for this, but I genuinely believe they're putting too much work on the GP. And I think the GP has a hard enough job without having to know all the professionals in his area. Oh yeah, that's a good acupuncturist. I'll refer you to that. I think GPs have enough to cope with, but at least the conversation is there. And as it's there, the hope is, of course, that if more patients and want to know about this stuff, then we can give the body of evidence that we've collected to the NHS, for example, and they can make more resources available. So I think that's it. Yeah, I think that's me done.
Excellent. All right, thank you. So a lot of information about cancer coaching. I just wonder if there's any questions. I've got a question, because I had cancer. I never had a cancer coach. So I just wondered where it would fit in with people who, I don't know whether, I mean, I'm listening to you thinking, did I really need it? Why do you think everybody should have a cancer coach? And what is and if that's a yes, what would the benefit? I mean, you've told me the benefit, but I'm not convinced that I would have had time, especially with you know, you're running around with all the, you know, I had young kids, and then you've got all the appointments and people who want to see me. So, yeah.
No, it's a really good question.
Oh, can't hear you again.
Again. So,
Here we go. There we go. Can you hear me now?
Yeah.
Yeah. So that's a really good question. I guess I would say from seeing people who were coming into having received that diagnosis in the most frightened, disorientated, fearful place, and then see how working with the coach gave them the confidence to get through treatment, to take some steps to provide better, to enhance their treatment outcomes, and then to engage in a life committed to reducing the risk of them getting the disease again, I would have to say yes, everybody should have access to a cancer coach. I also, and the video touched on this, if any of you heard it, it's also a place for you as the patient to speak openly without judgment, without any fear of basically being judged, to an impartial person who has gone through a very similar lived experience to you. And we hear this a lot from people who will say, I have a wonderful support around me. I've got a wonderful husband, a wonderful wife. I've got a mother, a father, kids, co-workers. But they still benefit from having somebody at arm's length who they can just bleh. And it can be the most, it can be whatever the person wants to talk about. And it's, I guess on the back of that, there's a consistency, because your cancer coach can be with you for as long as you want. And one of the things I hear a lot from people that go through cancer treatment is that they're tired of telling their story to so many freaking strangers. Every time they go and see a new consultant, they've got to tell their story again. They've got to go through it again. And the cancer coach is somebody that you speak to, and it can be, oh, how are the kids doing at school now? Because there's a relationship there. And it's just having that consistent companion is probably the best way I can put it. So there is a huge benefit in understanding lifestyle environment, preparing somebody for treatment, guiding them through treatment so it's as least invasive as it can be, and then preparing them for a long-term life after cancer, thrive after cancer as opposed to survive after cancer, and then just being that constant person in their lives if they want, that they can speak. And here's another, if I may, I'm sorry, just one other example I think people on this in this presentation can understand. Cancer is something, even after treatment, you are always going to have to be, you will always be mindful of, always. And you are reminded of it because you're told to come in for regular tests, 3 months, 6 months, 9 months, 12 months. And there is a term, I heard this first in America many years ago, called scanxiety, the anxiety that comes from going for another scan. And our clients who have worked with a cancer coach have felt tremendous benefit and support, being able to speak to somebody again and get themselves ready for going for that scan. So, but if I also may say, on the reverse, and this is where I think Tree of Life was driving our service delivery, there are not enough health coaches to deal with the amount of cancer. So if you said, we're in the UK, right? And I think in the UK, we're at 300,000 new cases a year. I think that's kind of the number, isn't it? 300,000. And each coach can carry a caseload of around, what, maximum I'd say is 30. I can tell you there's not that many coaches in the UK. So Tree of Life was an opportunity to give everybody a solid 101 understanding of how lifestyle and environment can play in their cancer journey without having to always provide health coaches. It's also cheaper, from a price point perspective. So yeah, I hope that answers your question.
Okay, so we've got a few other questions actually now, and also please put your questions in the chat if you want to ask Luke anything. So we've got the first question is, what got you into this, and what's your background? Why are you doing it, I guess is the question.
Yeah, I think similarly to a lot of people on this call, I've experienced people going through cancer. I haven't myself. I have to say yet, don't you now, touch wood. But I saw family members. I've lost 3 or 4 of my parents and grandparents, or parents really, including the in-laws. So 3 of the 4 have died of having cancer. And my own personal health journey was more understanding the chronic illnesses. So if any of you care to look at my LinkedIn profile, you'll see that I've been involved in medical spas, drug and alcohol rehabilitation, other chronic illnesses, and including cancers. And going through, I did my residency at the Hippocrates Health Institute in West Palm Beach, Florida, and got to spend 6 months working with them in that institution. And it's not a cancer specific institution, but they had many people with cancer coming through their program. And to see how relatable these chronic illnesses are to one another, how interchangeable the symptoms are before they present a diagnosis, made me realize that I wasn't too far away from my understanding of other chronic illnesses to developing a strong cancer program. And then, of course, I reached out to Penny Kagogolu, Catherine Steele, those who actually have the qualifications and experience to actually help me create this program. But ultimately, it came from a learned experience that a lot of chronic illnesses present themselves in very similar ways to cancer. And then having lost 3 or 4 of my parents to it, I thought it was about time somebody gave it a go.
Okay, we've got a few other questions coming in, so I'm going to rush these because we've got 15 minutes left. But keep asking questions because we can go over time if we need to. So as long as you can stay. So there's a question: do you see a difference in people's needs between countries? Is there different? Do people have different needs depending on what country they're from? Do you see a difference in needs between?
In what country they're from?
Yeah. I think that's an
absolutely.
interesting question. Can't hear you, Luke, again.
What's it gone again? I'll be trying again.
How's that?
Yeah, that's better.
There we go. Absolutely. And I would say in 3 ways: language, cultural sensitivity, and diet appreciation of nutrition and diet. So it might not be a popular thing to say, but I'll say it anyway. I don't like these intense diets that seem to come around serious illnesses, including cancer. You have to go raw vegan. You have to go keto. You have to go paleo. I've seen no evidence. And I told you, I read this stuff for fun. There is no long-term evidence to say that any one nutritional protocol will work for you better than any other. And it really comes down to having a diet that is what we like to call nutritionally dense. So getting the maximum amount of nutrition per calorie. So it goes without saying, processed foods, nah, get rid of them. No need for them. Whole foods every day of the week. But why can't we have nice fish? Why can't we have a little bit of white meat? Red meat, I can see where the evidence is pointed to. But in moderation, nothing's going to cause you tremendous harm. The other side of the coin, however, I'm sorry, I want to just take an opportunity because it's something actually I heard again a few days ago from a learned colleague. Added sugar in food provides 0 nutritional benefit. Absolutely not. There isn't a piece of word that says, and yet you will find it hard to pick up any piece of processed food that hasn't got added sugar in it. So going back to what you were saying, yes, because you don't want to be bringing a intrusive, invasive diet to somebody who might not get access to certain food groups, or it might not culturally be part of their makeup. It might not be culturally viable for them to bring in certain types of food groups and nutrition. So cultural sensitivities, religious sensitivities, dietary sensitivities, access to food in those locations, and language. So yeah, absolutely, where the person is from can have an impact on the type of relationship they would have with a cancer coach.
Okay. And then we have another question. Do you have any quick tips for how to thrive after cancer?
How to survive after cancer.
Thrive. Yeah.
How to thrive.
What's the one thing, most important thing?
Again, it's probably not a popular thing to say, but all my coaches would say this, is be grateful for the experience. I know, it's crazy now, but you speak to my coaches and those who have thrived or have the intention to thrive after cancer, is to almost treat the experience in gratitude, so that every moment, as soon as they wake up in the morning, is a day that they're going to embrace, the whole carpe diem aspect. And I'll kind of phrase it a different way as well. I read something, I forget the name of the doctor. He gave a university commencement speech in the US a few days ago. And he was saying, and you know, you've got all these people that are just about to start university. And he was basically saying, when it all comes down to it, when people feel that they are at genuine fear of losing their life, they do not look for the trophies that they've won. They don't look for the certificates that they've obtained in life. They don't wish they spent more hours in the office.
I disagree with that completely. Sorry.
Oh, that's okay.
I'm so sorry. People tell me that a lot, and I think it really depends on who you are. Because when I was faced with cancer, the first thing I wanted to do was get back into the office. I'm really sorry to disagree with you. I hear what you're saying. I really hear what you're saying. But I just have to say, and I know that I'm very different from a lot of people. I think differently from other people. That's another story. I know that I'm different, but it's not everybody. The first thing, I couldn't wait to get back to work, because I thought, if I'm going to die, I've got young children, I'm going to make sure that they're looked after. So it's not always, I'm so sorry. I'm so sorry.
No,
I don't
no,
normally,
but you raise a
it's
really
not true.
good
I
point.
did want to work. I wanted to work more.
No, you raise a really good point. And let me finish let me finish my thought process, and I'll address what you were saying.
Yeah.
Ultimately, you know, life is you asked, what would be the best tip for thriving after cancer? And I was saying, be grateful for the experience. Be mindful of those things that give you genuine pleasure. And it is love and it is family. And that is all that ever matters, is love and family. The point that you're coming to is really interesting. And it is becoming, and I completely get it. So a lot of recent data is telling us that the largest incident rates, those who are actually getting diagnosed with cancer, are women in their 30s and men in their 40s. Breast cancer for women, prostate cancer, stomach cancers for men. They are the largest increase incident rates, which is scary. And to your point, absolutely, as a society, we have become more wrapped in making our work and our job part of who we believe we are, part of our personality. We do. So
that's not why
going
I wanted
back
to go back to work.
Pardon me?
That's not why I wanted to go back to work. I wanted to go back to work so that I had enough money, so I would leave my children, I'd leave my family financially secure. It's another subject.
No,
sorry.
no, it isn't.
I don't. Yeah.
No, I want to talk about what you're saying, because it is really interesting data, because historically we've always considered cancer to be an old person's disease. You get it at retirement. As long as you're comfortable, you're going to be fine. But these people have a lot of their personality and sense of worth and purpose attached to their job. And when somebody's given a cancer diagnosis at 30 and 40 years of age, when they've just started to get on that management ladder, they've just started to build a career, and then all of a sudden, that sense of identity and self has been ripped apart. And the boss has told you something beautiful, which is go home, look after yourself, come back when you're ready. So many of those younger people actually have better treatment outcomes if they can maintain focus at work. They know that they can still contribute to work. The point that you're coming to, is the third element, is not only is there a fear of the health fear of getting a recurrence from cancer, There's now the financial fear
Mm.
of recurrences of cancer.
Mm.
And again, if you're getting diagnosed younger and younger, good luck trying to get life insurance if you've had a cancer diagnosis.
Mm.
It ain't happening. You know, so to your point, there is a whole new there's a whole new group of fears now because cancer is becoming more prevalent in younger people than where we used to address it when it was attached to our grandparents. There's a loss of self and identity by not being able to go back to work. There's a really good campaign at the moment called what's it called? Not working with cancer. Publicists have done it. It's really anyway. The CEO of Publicist Group, which is a big advertising agency, he got diagnosed in his 40s, and he realized how difficult it was to come out to his staff and his team that he had a cancer diagnosis. He thought it might make him look weak, or he was worried that he might not have his job, and he wanted to raise the profile and reduce the stigma of people being able to be upfront and say to their their employers, I've got a cancer diagnosis, and actually what would be best for me is if I can still contribute to work whilst doing my treatment. And that's, I guess, just coming full circle. That's where cancer coaching is extraordinary in being able to help people build those integrated lives of doing treatment whilst maybe still going to work or doing some work from home. But yeah, I hear you. And no one cancer journey is the same. And I think we can all agree on that.
Yeah. So, yeah. I've got a last question, which I think is very important and relevant, actually. So Jill says, you talk about the end of treatment, but with my cancer, leukemia, there will probably never be an end. And there's a lot of people who are stage 4 or leukemia or in that situation. So, and in this case, would a cancer coach still be able to help?
Yes, in so much as we talked about earlier, having somebody in your corner who knows exactly what you are going through, that you can reach out to whenever you need to reach out to them, who understands the journey that you have gone through, who understands the medical terminology. Let's not forget, cancer is a whole new glossary of terms. You know, you'd be amazed how brilliantly adept cancer patients are when it comes to explaining their diagnosis and using words they never even wasn't even in their lexicon. So to have somebody in your corner, somebody who can give you questions to ask your oncology team, for example, very good thing that a coach is able to do is to take an objective view of your diagnosis and prognosis, having had a lived experience themselves, and say, okay, next time you see oncologists, ask these questions, so you feel more in control and more aware of the treatments that you are likely to go through. So I would say for people who are perhaps more aware and understanding that their cancer is unlikely ever to be in remission, or perhaps have been given an end-of-life care plan, cancer coaching can still help and assist in making that transition and that journey as pain-free as it possibly ever could be. But it's about just having that consistent companion, I would say.
Okay. Right. Thank you very much. I think that's a lot to think about there.
Yes.
There's I think I could ask you questions and discuss this for ages. So yeah, thank you.